Hello, I'm Nimal Jude and I'm a registered social worker. And I'm going to be reading from the chapter that I co-authored with Mark Harvey and Zohal Shafiq. And it's about the workforce race equality standards. And hopefully when I start reading, you'll hear a little bit about what it's all about and who the other people are. So this story is about the creation of the Workforce Race Equality Standards, or RES for short. The RES is a way of monitoring experiences of white and minoritized staff. The NHS have a RES, but despite all we know about the barriers to opportunity for Black staff working in social care, there was, until recently, no social care equivalent. So this is the three of us, as I said, telling this story, and we all relate to the issue of racism from different perspectives. Two of us are women who, because of the colour of our skin, have experienced marginalisation. And one of us, Mark, a white male, is privileged to have no such experience. Our story is of allyship, activism, personal experience, and the real life impact of an institutionally racist system that doesn't reflect the wondrous diversity of our workforce. The work of Social Work Action 21 made us reflect back on the journey to RES. We've much to learn, but also a drive not to let this slip again. And then the book the chapter goes on to talk about Mark's reflection of sitting in an auditorium when he was kind of a bit uncomfortable about looking around and seeing lots of white senior leaders. And that was at the NCAS, which is the National Children and Adult Service Conference. It's a conference that happens every year. So there he was, and he kind of talks a little bit about there he was kind of sitting around, looking around. And I think he was with a colleague at the time who then suddenly sort of said, what's going on here? We know that we're a really diverse workforce, but where are they here? And I think that he said something like, looking around the conference, I have to question whether the diversity in this hall reflects society and social work. So as social workers, we were incredibly lucky, and we are incredibly lucky to work in a profession that values everyone. We seek social justice, equality, human rights for all. Where these are absent, it's our role to do something about it. So they were sitting there thinking, well, yeah, we've noticed, but what we're going to actually do about it. So we know that social work at operational level is one of the most vibrant and diverse professions, and data from UCAS, which is the University and College Admission Systems in 2020, showed that in terms of race, social work, I think probably is, but was at that time the most diverse undergraduate course in England. So what was going on? Where were people within leadership? And then the chapter continues about you'll see some data from a Freedom of Information request about senior leaders in social work. So I'm just kind of skipping forward a little bit to the summer of 2020. So in 2020, the summer of the first lockdown, work to develop a social care workforce race equality standard through the Chief Social Worker's Office for Adults at the Department of Health and Social Care began in earnest. We knew the next few months would involve us flying the plane while building it, and all from our virtual working setups in our bedrooms. We also knew we'd be relying on the support of colleagues to push forward the social care RES to make a real difference. The topic of race was bound to bring another level of personal and professional investment from us all. We were ready for it. We'd all worked on a variety of projects to support and uplift the profession before, but this felt much more emotive, tapping as it did into the pain and trauma of racism that the minoritized members of this group and the Chief Social Worker's Office carried with them at all times. And so skipping forward a little bit more, action was needed, and seniors throughout local and national government began to wrestle with their responsibility to respond to staff forums throughout many local authorities And this was like after the murder of George Floyd. So this was sort of happening at that time. And you know, that's what we were hearing is senior leaders sort of saying to us, what can we do? So senior leaders were shocked at what they heard and reported, that they had no idea of the extent of the experience of racism in their workforce. And commitments were made to address racism in the workplace. And people listening may have experienced that themselves in terms of how you spoke about how it felt during that time. So Zohal, Shafiq, who's one of the other authors of this chapter, Zohal liaised with policy advisors and analysts to devise plans for national action which pushed for creative and tangible solutions to tackle disparities head on. Amongst these plans was the urgent renewal and resourcing to implement a social care res. We knew we needed better understanding of the experience of social care workforce, including on discrimination, equality of opportunities. The workforce didn't need words of encouragement or temporary support measures. It needed and deserved long-term sustainable solutions. The social care res presented the first steps toward driving action and accountability and embedding anti-racist practice in the hope of cultural and systemic shifts. As always, it was easier said than done. And there are just a couple more bits that I want to kind of read before I end. Many people we spoke to at the time, and still are, were skeptical. I mean, let's face it, we've been here before. Minoritized people had long ago noticed the whiteness at events like NCAS. Only now, white people were noticing and showing commitment to do something about it and call out the inertia of their peers. Only now was the scale of the problem becoming increasingly apparent to employers. And just to end, the social care res will not make change in and of itself, but it is a strong commitment and one that we are proud many local authorities have taken on. We'll all make mistakes and be frustrated by the lack of pace, but this is a positive and long-awaited step forward. Our hope is that a few years from now, we'll have a strong national database and a set of creative, evidence-based activities that supports and protects the well-being and aspiration of our minority ethnic workforce and communities. This is about being the anti-racist organisations our professions would demand of us. And if our sector doesn't embrace these approaches, we must take action and demand it of ourselves. Thank you.